Your time's up.
Thank you.
Jennifer Feldmann.
Thank you. Thank you, Chairwoman and the committee, for the opportunity to speak to you about my opposition to SB6. My name is Dr. Jennifer Feldmann, and I represent Legacy Community Health, which is Texas' largest not-for-profit community health center, which cares for 125,000 Texans ranging from Houston to Beaumont. I'm a double-boarded pediatrician, pediatrics and adolescent medicine, and I provide primary care to teenagers as well as young adults of all walks of life. And of all my patients, those at the greatest risk for suicide are my transgender teenagers. You've heard the statistic of 4 in 10, but I'm going to say it again. 4 in 10 transgender young people attempt suicide. If they live in a hostile environment or discriminatory one, it's 8 times that of a typical teen. And the concerns I'm stating are echoing those of the Secretary of Education for President Trump. I'm going to tell you about a patient I'm going to call Josh, and he's 12. His parents drive 4 hours each way to see me, and he came into my care after a failed suicide attempt. After that, he told his family it was because he was transgender. His parents didn't know what transgender was, and they knew right then they had a choice to make. They could have a dead child or a living transgender son, and they chose to love their kid. Because of that love and acceptance, Josh is now a much happier person. And we know from lots of patients like Josh, and also scientific research, that discrimination is lethal. But its antidote, acceptance, is also equally powerful. SB6 is unfortunately blatantly discriminatory, and it puts a brighter bullseye on the backs of my transgendered youth clients. It makes them notice for being different. But parents, school officials, and educated people and elected leaders like yourself can lift these kids up rather than tear them down with things like SB6. And lifting them up can erase this enormous mental health risk that plagues the community. I'm hopeful you'll join me in saving lives and oppose SB6.
All right, thank you.
Madam Chair, I have a question.
All right.
Doctor, I was just wondering, could you give us an example of what you think we can do as a state to lift the child, as you're suggesting? I mean, I think all of us are concerned, and you're opposed to this bill, but what else could we be doing as a state to help lift up transgender children and other children that face challenges in our schools?
I think that the kids now, all kids deserve to be safe in schools, every last one of them. And I think the way it is now, with kids can be safe, and I think all kids deserve that. I don't think any changes need to be made right now, or changes to the negative need to be made right now to make kids safer. I think just as it is, a case-by-case basis would be a great start.
Okay, thank you. Thank you, Madam Chair.
All right, thank you. Elliot Dupree.
My name is